During the pandemic, there have been a number of different places that you can go to find out some of the numbers that are going on with COVID-19, numbers of tests, numbers of cases, hospitalizations, and things like that. The official government one, though, has been the CDC. Obviously, they are there to get the country ready for pandemics and respond when they come. But that is actually changing as of today, with the Trump administration ordering hospitals to bypass the CDC and send all COVID-19 patient information to a central database in Washington beginning today. From now on, the department, not the CDC, will collect daily reports about the patients that each hospital is treating, the number of available beds and ventilators, and other information vital to tracking the pandemic. So it begs the question, why make this significant change? It's a historic change to how the government tracks vital public health information. Officials say that the change will streamline data gathering and assist the White House coronavirus task force in allocating scarce resources like personal protective gear and remdesivir. Brett, don't do that. The first drug shown to be effective against the virus. But the Health and Human Services database that will receive new information is not open to the public, which could affect the work of scores of researchers, modelers, and health officials who rely on CDC data to make projections and crucial decisions. So, Ben, I know you likely talked about this on your show. It's a pretty big change. When you see this, what does your gut say?
My gut is saying that Trump doesn't want this data out there in the public, right? That's basically the gist of it. He's tired of all the negative numbers. The thing is like on the surface, it looks as if this is going to be like some type of masterful manipulation. But if you remember what happened in Florida when they tried to fudge the numbers there, and they did so by inverting a Monday with the Tuesday data so that it could look like it was decreasing. This is like, they're not really sophisticated in what they're attempting to do, but they're just patently blatant. They don't care. They don't care that this is a seizure of science, right? They're in the middle of a pandemic. They don't have any regard for the safety of Americans or accurate information. They just need to control the narrative, because the narrative is really damaging to them.
Yeah, I wonder, so you gave a great example of that sort of the switching the days, and we know Florida fired the person who'd set up sort of their data visualization thing that was providing a great level of information, granular information about the pandemic. So those things have happened and they've been caught. The fact that Florida hadn't been reporting hospitalizations for so long, we knew that, so we could pressure them to do it. Do you think that could happen with this new change? Like, for instance, if they do start to mess with the numbers, I'm trying to figure out if we would know, if there's any way, like, would independent organizations be able, would they be in touch with enough hospitals to tell? Like, I'm trying to figure out if future manipulations might be invisible to regular Americans and to the media.
I mean, I think that's the whole point, John. I think the entire point of this is to be able to seize the data and stop this information from going out. And what we're going to see, the other thing that happened, I believe it was in Florida, instead of reporting the deaths as COVID-19 deaths, they started lumping them in with pneumonia deaths. So they're going to be stacking all these bodies, right? It's not as though changing the data is going to stop the pandemic. Donald Trump wants to wish the pandemic away. That didn't work. So now he's going to seize the data and try to kill the narrative. But then you still have bodies that are piling up, unfortunately. And so he can't deny that, but we're going to see a spike in pneumonia deaths, basically. We're going to see a spike in all other associated deaths, but he's going to try to kill the COVID-19 narrative.
I feel the same way. I think that that's definitely coming. I mean, as you allude to, it's already here. And the issue is, like, at some point, scientists are gonna go through all of this and they're gonna figure out what the numbers actually were to the best of our ability. What I wonder though is, let's say he does sort of fudge the numbers. Because he's been talking about the fact that there's too much testing, the cases aren't reflective of what's really going on, it's just from testing and all of that. Does it actually matter? I mean, it matters in terms of reality. It matters to me because I care. But in terms of the American public, like, I feel like the people who don't care, who wouldn't care that he did it, are the ones who don't care now about the deaths. Like, I wonder how entrenched everyone is that. Does it matter if we hit 200,000 deaths before the election politically? I mean, obviously it matters morally and in terms of public health, but does it actually matter to his base? Would their mind change if we hit 175, 225? What do you think?
So that's the thing I shouldn't be shocked by this, but I am, right? So in response to this, like, this story has been everywhere today, and everywhere I look, there's been enough Donald Trump supporters saying, thank you. Finally, we're gonna be able to get some accurate data, get the data away from the CDC, right? And so that just shows you that no matter how far Donald Trump goes, there will be a base that follows him. And I think that base kind of is somewhere around 35, 36%. We see no matter what Donald Trump does, he never falls below a 35, 36% approval rating. And I think he's gonna take that base with him all the way to hell and back again. So it's not even a matter of him standing on Fifth Avenue and shooting someone. It's really a question of how many bodies will pile up before that 36% break. And I don't know that there is a number there.
I now have a family member who's in the hospital right now, and I think is turning for the better. I think that that's good. And I just think about how many families are experiencing the exact same thing right now, and how many have already had far worse happen, lost family members.
Yeah.
And for the only sort of administrative effort in the past few weeks that I can think of from the administration to be trying to get like a strangle grip on the flow of information so that they can hide the extent of the pandemic is just, it's abhorrent in every way that something could be.
I think we should make note that Donald Trump is putting more effort in controlling the data than he is actually trying to control this virus.
You have a statement from Michael Caputo, HHS spokesman, who says the CDC's old data gathering operation once worked well, monitoring hospital information across the country, but it's an inadequate system today. The president's coronavirus task force has urged improvement for months, but they just cannot keep up with this pandemic, which I love. There's a note, I think from Brett in our document, which is he's saying Trump handled this so badly, the CDC can't even keep up with it after months. No one else is gonna get that. It's great that Brett caught that, but that is a pretty stark admission.
Right. That's an accurate, right, admission, but it's going to fall on deaf ears with his supporters. What they're reading, as they read that, they're saying that the CDC is incompetent, right? Yeah. I mean, that's 100% the narrative that they're going to spin. And then also, like Caputo, when I was reading this earlier, he's actually trying to make it seem as though this is not as bad as it is, because he's trying to make it seem as though the CDC will have dual access to this data. But as you read the statement, the order, it really says that they are circumventing the CDC. So the only data that the CDC will get will be something that comes back from Washington, D.C. And so the double speak in here is Orwellian at best.
One other thing I wanted to talk about though was, I really only saw this talked about in an NPR article about this. I read the initial reports in like the New York Times, and I don't think that they acknowledged this. But so they had previously had a system with the CDC for reporting of this information, this setup that had been there for a while. They have a new system. It's called Teletracking, or it's set up by Teletracking, a private company based in Pennsylvania. That company was awarded a $10 million contract in a non-competitive bid in April. Why? Who do they know? Are they qualified? Who knows? I mean, I'm sure, Ben, you saw the stories earlier where like massive multi-million-dollar contracts for PPE were given to companies that didn't exist the week before, those sorts of things. And for something so crucial, now we get to worry about corruption, and we also get to worry about incompetence possibly. So that's great.
Yeah, there's a confluence. There's like an intersection of forces right here happening in America in 2020 that's perfectly fit to like undermine our country. Like I mean, we don't have to worry about some external force, any military strike. It's going to be the incompetence, the ignorance, and the corruption of America that is ultimately our Achilles heel.
Here are the most recent numbers on the pandemic. We think that these are fairly accurate. You know, we'll see in a few weeks what we'll have, but over 3,055,000 cases, over 132,000 deaths. New cases on Wednesday, 62,751. You know, I recently went back to, I forget why, I had to find a clip or something like that. And I watched one of the early reports we did about this, and it said something like there are now 3,000 confirmed cases. And I thought, wow. If I could go back and talk to that John, he would have had no idea what's coming. 3,000, that's a good hour in America these days. Jeez.
Yeah, that's a terrifying notion. Like the rate that, what's underlying that terrifying notion is the fact that it didn't have to be like this. Right, there's literally no reason we had to have this many people infected, or even this number of these many people who have died at this point. And then we're compounding it, John. It's like we're not satisfied. They're not satisfied with 132, 135,000 people being killed, but because of this, they're doing everything they can to possibly exacerbate the problem.
Yeah, it's like 132. You know, that's good, but like, can we like get a bunch of kids together or something like that? I think that could really juice these numbers.
Yeah, I mean, and I don't understand like what is the actual motivation? Like there on any given day, I think we talked about this last week on your show. On any given day, a school is going to be an incubator. It's going to be a petri dish, and that's when the sun is shining. And now in the middle of a pandemic, they're like, 132. I think we could do a lot better than that. Let's send these kids back to school.
Thanks for watching The Young Turks. Really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.